Welcome everyone to today's call. As always, don't implement anything you learn on today's call without first speaking with your general practitioner. Today I'm excited to talk because there's been new research into COVID that's revealing or helping us answer the question as to why do some people who get infected have a mild response versus other people have a more severe response. And a recent publication in the journal Science came out, and it's entitled Systems Biological Assessment of Immunity to Mild versus Severe COVID Infections in Humans. And this is out of Stanford University. So some big time researchers looking at a big topic for us. And what they did was they looked at the immune responses of 76 COVID patients compared to 69 healthy individuals. And they looked at groups of patients from Hong Kong and Atlanta, because part of their inquiry was how are people reacting around the world to COVID, and is it similar to what we're seeing in people in the US? And what the researchers found was there's three main areas that COVID is impacting immunologically that determines how severe a person's response to the infection is. And the first area that they found was that the virus impairs our innate immune response. And so if we're talking about the immune system has, in school they teach that the immune system has two parts to it. The first part is called the innate immune response, and the second part is called the adaptive immune response. And so I picture it like the innate immune response is the local police. Okay, they're on the ground, they're ready. If there's a robbery or a kidnapping or a domestic issue, they're on the scene right away. So there's some sort of inflammatory trigger and they're there right away to respond. The adaptive immune response I picture as like the SWAT team, right? They have to call and be mobilized to the area, but then they're highly trained. We have snipers in the SWAT team, we have bomb squad, we have negotiators, we have different jobs. And so if you think of it that way, the innate immune response would be local police who can help right away and kind of deal with it until the specialized forces can come and show up. And so the SWAT team is our T cells and our B cells, and the B cells are what make antibodies for us. And so these researchers found that the blood of COVID infected patients have an impaired innate immune response, which means the local police respond more slowly or less efficiently to COVID infection. Now, why would that be important? Well, because if we have a robbery going on, right, the perpetrator is going to create more damage or steal more things before the police show up, or it may steal and get away before the police show up if they're slow to respond. And so basically from a SARS-CoV-2 perspective, SARS-CoV-2 is the coronavirus that causes COVID. So SARS-CoV-2 is the virus, COVID is the infection, or the disease, that the group of symptoms and everything that SARS-CoV-2 causes. So with an impaired innate immune response, COVID or SARS-CoV-2 gets a better hold in our body before it is recognized and addressed by our local police. So it gets more headway, the infection goes further along before the local police show up. So that's an issue. The second thing they found was that there's significant increased levels of inflammatory markers in the immune system, specifically in the blood and in the tissue. So whereas the innate response is impaired, the adaptive response or the SWAT team response is ramped up. And so you may have heard on the news about certain patients who are severe having the cytokine storm. Cytokine storm is a fancy term for just high inflammation. Okay, you have this robust inflammatory response that is systemic and is too much for the body to deal with at one time. So we have an impaired innate response, impaired local police, and we have a robust SWAT response or adaptive response. So that can lead to more tissue damage, more systemic disease, more organ damage, and potentially death. And then lastly, what they find is that there were higher levels of bacterial DNA and bacterial metabolites in the plasma or in the blood of the more severe cases. So what that means is the researchers are thinking that the bacterial DNA is coming from tissues and entering the blood, and they suspect in COVID it's bacteria coming from the lungs. Okay, so bacteria that were housed in the lungs and potentially being controlled by the immune response, now in severe cases they're finding the bacterial DNA and their metabolites that are highly inflammatory in the blood, which can drive systemic inflammation and again a more severe course. So this is interesting because it helps us understand why some people may be mild, some may be severe. The people who are healthier and have a more discerning immune response are going to be less likely to have the impaired police and the overactive SWAT team versus people who are less healthy and maybe have multiple comorbidities like obesity or diabetes or hypertension that we've heard about in the studies. Those things all promote a more severe response in COVID infections. Those people are chronically inflamed, so their immune systems are less discerning, potentially more exhausted, and less able to mount the proper response. So they have a more severe case. And then one line that I thought was interesting here in the study is, it says, of note, the effector T cells continued to increase up to day 40 post-symptom onset. So, you know, it's possible for someone to be infected and have COVID and recover from a symptomatic standpoint. And then what we've seen, what some cases have shown is people have a second flare of the symptoms. And perhaps it's related to this, where you have the initial infection and you recover, but underneath the hood or below, you know, subclinically, your T cells are still continuing to ramp up. And so if you are re-exposed to COVID the second time, you have more SWAT team ready to respond. And so the symptoms can be worse the second time because the response is more robust. So from a treatment perspective, that's important for clinicians because we want to not just stop care when symptoms end. We want to continue care, say a month or two after the infection looks like it's cleared, so that we're supporting immune balance, immune surveillance, and total clearance of the virus. Now, that's the, say, nerdy coverage, the research coverage of it. Here's a graphic from the Precision Lifestyle Medicine Institute that they had a podcast with Dr. Aristo Vojdani, who is the doctor that actually created IgG antibody testing. And he recently covered this topic with them on their podcast, which is, why do many people exposed to SARS-CoV-2, some people don't get infected at all, some are mild, some are severe. And he broke it down like this. So we know that respiratory viral droplets are how the virus is spread, or that's the mechanism. So you can pick up those viruses through inhaling them through the mouth or nose. They may land on the eyes and enter through that way. And then basically, we've all got viral barriers, or we've all got multiple mechanisms or contributing factors that determine our immune robustness and our resilience overall in terms of health. And those factors are your exosome, your mucosal immunity, your neutralizing antibodies, the expression of viral receptors, your innate immune response, and your anti-inflammatory capacity. So if you've read my book, The Autoimmune Answer, I talk about the exosome being one of the 3 key factors of the functional medicine framework in addressing autoimmune disease. What is the exosome? The exosome is a fancy term for all things that you've been exposed to since conception forward. Research shows that from conception forward, everything you're exposed to is contributing to your state of health or disease. So the toxins you're exposed to. Did mom or dad eat or drink, you know, during the preconception time? What was mom's stress levels while you were a fetus? You know, were you vaginally birthed or C-section? Were you breastfed or not? Were you vaccinated or not? Did you have dogs or not growing up? Like everything matters. And so the cleaner your exosome, the better. The more exposures you've had, potentially the more serious the infection. That's what you can see with the plus signs here. So second is mucosal immunity. If respiratory viral droplets are how the virus is spread, and we pick it up through the eyes, nose, or mouth, those are all mucosal barriers, right? So your mucosal immune system is the first line of defense from the outside world to inside you. So if your mucosal immune system is strong and robust, you may inhale those droplets, but the virus never gets hold because your immune system was robust there at your barriers and said, thou shalt not pass, and took care of it there. If people with mild infection are suspected to have a mucosal immune system that isn't as robust as the people who don't get infected. And of course, if you have a serious infection, it's likely that those people's mucosal immune defenses were suboptimal to begin with at the time of infection. Neutralizing antibodies. So do you have an adaptive immune response and previous exposure to coronavirus, say? Up to 15% of the common cold is caused by coronavirus. So we've all been exposed to coronaviruses. We may not have been exposed to SARS-CoV-2, but we've been exposed to its relatives like SARS-CoV-1. And so if we've had the common cold caused by coronavirus, we've produced antibodies to it, and sometimes those antibodies are similar enough that they can recognize other coronavirus family members. So if a person has enough of those, they may not manifest an infection when exposed to SARS-CoV-2. If you have less, you might have mild infection. If you have none, you may be more severe. Viral receptors. If we have viral receptors expressed on our cells, the less viral receptors. Let me back up. In the research, it says the SARS-CoV-2 virus likes to attack the ACE2 receptor. The ACE2 receptor is highly expressed in our lungs. So the more ACE2 receptor expression you have, the higher the risk of COVID infection. So those that don't get infected probably have less ACE2 receptor expression. Mild and severe have more. Like we just talked about, the innate immune response is key. That police force is key in stopping any attack at the start. So the healthier your innate immune response, better. So people who don't get infected likely have a healthier innate immune response than people who have a severe response. And then your anti-inflammatory capacity goes hand in hand with that. The better you are at putting out fires, the less likely you are to progress to a severe infection. I think this is an excellent graphic by Dr. Vojdani to show multiple potential contributing factors. And it's also helpful clinically because this gives us hope. Instead of living in fear and staying locked up in our houses and not wanting to go visit family and all of that, these are actual actionable targets for us. So I can say, okay, if exosome matters, which means all of my exposures, then that incorporates your lifestyle. So if I'm worried about being infected with COVID and I know my lifestyle has been unhealthy, I can clean up my lifestyle. I can clean up my nutrition and my diet and my physical activity habits and my sleep and my toxin exposure, etc. And by doing that, I'm actively decreasing my risk of severe infection if I am infected. Mucosal immunity. I can test that in the office. So if we test a person's mucosal immunity and we find that it's subpar, we can take action to improve that. So again, if there are actionable targets, we have hope as clinicians and patients because there's things we can do to help ourselves. If there are no actionable targets, that's hopeless and that promotes fear. But there are actionable targets. Neutralizing antibodies. That, again, clinically, we can support that by optimizing immune response. Viral receptors expression, There are things that increase or decrease expression of certain receptors. So making sure, like vitamin D levels have been tied to ACE2 expression, inflammation has been tied to ACE2 expression, certain medications are tied to ACE2 expression. So you can tweak those factors to impact your viral receptor expression. Innate immune response. The innate immune system can be impacted by multiple nutrients and herbs and lifestyle factors. So again, we can take action to promote a healthy police force. And then anti-inflammatory response. Again, lifestyle is a big player there. Are you eating a pro-inflammatory diet or an anti-inflammatory diet? Are you sleeping properly, which is anti-inflammatory, or are you staying up too late and sleeping poorly? That's pro-inflammatory. Are you sedentary or physically active? You know, do you have a optimistic outlook or a pessimistic outlook? All of those things help determine your overall anti-inflammatory capacity. And so all of those things provide actionable targets for us to be able to improve our antiviral robustness and antiviral capacity. So I just wanted to share with you today, new research that is showing science is continuing to pursue answers to help us best understand this virus, help us best understand how to create a healthy immune system and give us the best response to this virus. And while you're improving your response to this virus, you're also improving your response to other viruses and your overall health.